This is Political Forum for Wednesday, January 14th, 2015. We welcome today as our special guest, Cook County Board President Toni Preckwinkle. Welcome back to Political Forum.
Thank you for inviting me.
I'm Rod Joy, a board member here at CAN TV. Political Forum is a live, interactive call-in program that's designed to connect you directly with your elected official. Over the next 25 minutes or so, we hope you'll have an opportunity to learn more about President Preckwinkle and her views on some of the most pressing challenges and opportunities facing the county. Above all, this program is about fostering a strong sense of civic engagement in Chicago. Your voice, your views are a big part of the program. We invite you to join the conversation by calling in at 312-738-1060. That's 312-738-1060, and we'll try to get to as many calls as possible. President Preckwinkle, welcome back to Political Forum.
Thank you very much.
You very recently unveiled a bold and ambitious plan for your second term in office that includes a focus on public health, public safety, and economic development. Why don't we talk a little bit about the public health system in the county and what has changed over the last 4 years?
Well, first of all, I want to thank all your viewers for my re-election. I was elected to a second term in November, and I'm very grateful for the opportunity to serve the people of Cook County for another 4 years. An important part of the county's responsibility has always been public health and the provision of health care to the uninsured and underinsured. And historically, that's meant that we operated a hospital, Stroger Hospital, also Provident Hospital on the Mid-South Side, and clinics all around the county, as well as a public health department. And what changed 2 years ago, a little more than 2 years ago, was that the county provided care through County Care, which was an expansion of the Medicaid program. So we were able to serve low-income individuals and couples for the first time with a federally supported program, Medicaid. We got permission to start that early. It's part of the Affordable Care Act, President Obama's health care reform. And in October of 2012, we got permission to start enrolling people in this basically managed care program run by the county called County Care. And we now have 96,000 people who have gotten care through County Care, who are part of our system. And they can come not just to our hospitals and clinics, but to primary care clinics all across the county, 130 of them, all the safety net hospitals and all the academic hospitals. So we're moving away from a system that was a provider of care, as I said, for an uninsured and underinsured population, to being part of a managed care system that provides care to a much broader spectrum of our population. We're moving away from being a provider of last resort, more toward hopefully a provider of choice for people across Cook County.
Great. I think we have our first caller on the line. Caller, are you there?
Yes.
Welcome to Political Forum. What's your question for President Preckwinkle?
My question is, since she based her second term partly off of economic development, what is she going to do as far as county-wise to help small business?
Well, let me just say, when I came into office, I said, I want to talk to the head of the Bureau of Economic Development. And I was told there wasn't a Bureau of Economic Development. We had a building and zoning department, we had community planning, community development, capital development, and we had a workforce development entity called the President's Office of Employment and Training. So I said, look, let's create a Bureau of Economic Development so we are more focused and comprehensive in the way that we look at economic development issues. So that's the first thing we did. We created a Bureau of Economic Development. And we tried to be more strategic about how we used the economic development resources that are available to units of government. That's the first thing. Then we created a Council of Economic Advisors so that people could, from the business community, business leaders could advise us, not only on how best to use our internal tools, but also how to relate better to the business community in terms of growing our region. So that's the second thing. And the third thing is that as a result of the good work of our Council of Economic Advisors and the report that they produced called Partnering for Prosperity, we brought together the leaders, political leaders, business leaders, and economic development staff of the 7-county region. So it's not just Cook County, but Lake, DuPage, Will, Kane, Kendall, and McHenry, as well as the city of Chicago, to talk about how we might work together to build our region up. And we've come to the conclusion that there are 3 areas where we can effectively cooperate. One is on truck permitting. There are 200 units of government in that region, and that 7-county region, and each one of them has different regulations for size, weight, and the routes that trucks can travel. It makes it very hard for trucks to navigate, a system to navigate. And so we're trying to rationalize truck permitting. We're also working on helping small and medium-sized businesses export, because we know that businesses that export weather ups and downs in the economy better and have a better growth trajectory. And we're also working with metal manufacturers in our region, the Chicago Metro Metal Consortium, to try to support Chicago as a metalworking hub. So we're trying to more effectively use our economic development tools. We're trying to promote regional economic growth and cooperation. And we hope that will kind of lift all boats, that as our region prospers and becomes hopefully stronger economically, that will be helpful to small businesses within our region.
This is Political Forum, a live interactive call-in program. Our guest tonight is Cook County Board President Toni Preckwinkle. We invite you to flex your activism muscles and join the conversation. We're at 312-738-1060. I think we have another caller on the line. Caller, are you there?
Hello?
Good evening.
Good evening.
Hi, President Preckwinkle. I know that you've talked about ending automatic transfers of minors to the adult system, and I was just wondering if you could outline some of the specific policies that you're going to try to enact to end that.
Sure. Let me talk a little bit about juvenile justice. 100 years ago, Jane Addams and other activists said juveniles should be treated differently from adults. They're not mature people. They make rash decisions sometimes without thinking about the consequences, and we shouldn't treat them as adults. So Cook County had the first juvenile justice system in the country, the very first. And juvenile justice systems recognize that young people need intervention and rehabilitation and not punishment. So we were the first to have a juvenile justice system, but in 1982 we began to move away from that distinction between children and adults and began to put 15, 16, 17-year-olds into adult courts when they were accused of committing very serious crimes. The problem with that, of course, is that everybody knows, I think everybody, especially those of us who've been parents of teenagers, is that teenagers are not adults any more than children are adults. And we still need to treat teenagers, 15, 16, 17-year-olds, in the juvenile justice system rather than the adult system. But what was happening is juveniles who were accused of very serious crimes, rape, murder, robbery, were being put into the adult court system, and by judges, not very frequently, but sometimes. And then what happened is, after we're moving on from 1982, is that those automatic transfer decisions, that is, moving a juvenile to adult court, began to be made by prosecutors rather than judges. And what that resulted in was a spike in the number of juveniles who got sent to adult courts. More young people were sent, and for lesser crimes than the serious ones that I mentioned earlier: murder, rape, robbery, those kinds of things, violent crimes. And actually, the Juvenile Justice Institute did a study recently and said over a 3-year period, 257 young people were automatically transferred to adult court. 257. Only one of them was white. So what's happening is black and brown youth are being taken out of the juvenile justice system and put in the adult courts, where it takes much longer to dispose of their cases and where the penalties are much stiffer. So we're going to work in Springfield to make automatic transfers a rarity in our system rather than commonplace, and to put in the hands of judges the decision about whether or not a young person should be tried as an adult. Let the judges exercise their discretion rather than have the prosecutors make a determination about whether or not a young person should be tried as an adult.
I think we have another caller on the line. Caller, are you there?
Yes. Hi, Ms. Preckwinkle. I just want to say thank you so much. Thank you. We are what you need. Thank you so much. Thank you for coming into this, I don't know what you could call it, and fixing this. Thank you so much. You are empowering communities, people. Thank you so much. And if I had my way, you would stay in that job. You have a good night. Thank you.
Thank you. Thank you. I appreciate your encouragement.
I think we have another caller. Caller, are you there?
Good evening, Madam President.
Good evening.
We have a problem around the metropolitan Chicago area where I would say is a public hazard, where we have these traffic lights that's not really following the national safety guides, and it's really short. And me being a person, a visually impaired person, trying to make it across the street, or somebody trying to make it across the street in a baby cart, and they're not following the national safety guide. When I call my alderman or talk to somebody else, stuff go in one ear out the other ear. And I'm serious. You probably heard about those reports. What is going to be done about those?
Well, let me just say that the county's responsibilities are basically our public health system and the provision of care to the uninsured and underinsured, and now managing county care, a program for people who have disabilities and who are income eligible for federal support for their health care. We're responsible for the criminal justice system, and we're working hard on economic development. Questions about local traffic regulation fall to the cities, towns, and villages within the county. And they're not really anything that the county can have any impact on. They're the result of local laws. So I suggest that you continue to pursue your alderman on this issue and communicate to the mayor that you have concerns and see if we can get those concerns addressed in that way.
Let's go back and talk about some of your priorities around public health, public safety, and job growth. And you talked a little bit about the juvenile justice situation, but let's talk about the jails and the jail population. And you've said that our jails are the intersection of racism and poverty. What can you tell us about the jail system that you inherited 4 years ago and what your vision is moving forward?
Well, first of all, I think many of our viewers would think that the jail is a place where people are serving sentences. That is, they've been convicted of a crime and they're serving a sentence, or they're waiting to go to prison. And that's not true. 7% of the people in the jail are serving a sentence. So that means 93% are not. Of those who are in jail awaiting trial, because that's what the vast majority of the population is, 93% are awaiting trial. Of those who are awaiting trial, 70% are awaiting trial for nonviolent crimes. So they're in our jail awaiting trial for drug offenses, for shoplifting or prostitution, the things that people do to get money for their drugs, not paying their child support, traffic offenses. They're accused of nonviolent crimes. They are not convicted, they're accused. And they're awaiting trial in our jail because they can't pay their cash bonds. We have a cash bond system. So, people in jail are basically poor people who can't pay their bond. They're also overwhelmingly black and brown. 86% of the people in our jail are black or brown. 86%. Now, half the population of our county is black or brown, but 86% of the people in our jail are black or brown. And my bitter joke, which I tell all across the county, is that if you looked at our jail population, you would think that there are no white people who live in Cook County. So, you will find in the jail disproportionate numbers of black and brown poor people. So when I talk about the jail as being the intersection of racism and poverty, that's what I'm talking about.
This is Political Forum, a live interactive call-in program. Our special guest tonight is Cook County Board President Toni Preckwinkle. We invite your questions and comments for President Preckwinkle. Please join us at 312-738-1060, 312-738-1060. I think we have another caller on the line. Caller, are you there?
Hi, yeah, I think I saw you on this show last time you were on, and you talked a little bit about economic development and how you thought that, the Cook County need to look at beyond, like up towards Milwaukee and sort of the wider regional economic development. Do you still think that's true? And how have your efforts been in encouraging that?
Sure. Well, so in December of 2013, a little more than a year ago, we brought together at the Federal Reserve Building on LaSalle Street the political leaders, that is the board chairman or the presidents of the counties for Lake, Will, Kane, Kendall, McHenry, DuPage, and Cook, as well as the city of Chicago. And they're not just their political leaders, but the business leaders that they wanted to bring with them, plus their economic development professionals. And we said, first, can we work together to build up our region? And secondly, if we can work together, what do we want to work on? And as I talked about earlier, we agreed on working on truck permitting, trying to reduce vehicular congestion in our region. Chicago's the hub of the Midwest, and a lot of truck traffic and rail traffic comes through the Chicagoland region. Let's make that commerce easier by trying to deal with rationalizing truck permitting, and let's also support our metal manufacturers, Chicago's a metalworking hub, and our small and medium-sized businesses that are interested in exporting. Because as I said earlier, businesses that export weather ups and downs in the economy better and have a growth trajectory that's much higher than those that don't. So those are the things we're working on: truck permitting, Chicago as a metal manufacturing hub, and exporting for small and medium-sized businesses. And it all comes out of the work that was done by our Council of Economic Advisors, our business leaders.
I think we have another caller on the line. Caller, are you there?
Yeah, good evening to y'all.
Good evening.
This is Toni Preckwinkle. Okay, can you hear me?
We can
Yes,
hear
sure
you.
enough.
Okay, now when you talk about crime, right, why some of the other people don't have their bats and guns? Why, if they do a crime, why need the apparatus let them go and they don't get no sentence?
I'm sorry, I didn't hear your question.
Okay, now when you talk about crime, right,
Yes?
now when the apparatus let some of these people go, like the police, if they do a crime,
Oh, I see.
then why they can't get time like everybody else?
Well, I was an alderman for 19 years, so that's a local elected official. Those aldermen in the city of Chicago are probably closest to their constituents. Everybody has 50 to 60,000 constituents, and that's kind of the smallest district of any elected official. And I spent a lot of time trying to work with police on crime issues in my ward, public safety issues. And I will tell you that 95% of the people who are police officers are good and decent people who work very hard every day to do a difficult job well. And it's the 5%, frankly, that often get the attention, unfortunately. We need to hold our police, we need to support our police and the good work that most of them do, the overwhelming majority of them do, and we need to hold accountable those who abuse their police powers. And that's always been a delicate balancing act in this country. And in my view, we need to put emphasis on the accountability as well as the support and encouragement for those who are doing well.
This is Political Forum, a live interactive call-in program. Our special guest tonight is Cook County Board President Toni Preckwinkle. We invite your questions and comments for President Preckwinkle. Please join us at 312-738-1060, 312-738-1060. I think we have another caller on the line. Caller, are you there?
Yes, good evening.
Good evening.
Yeah, I have a question concerning your budget and what you see down the line in the future. I know you have a balanced budget, and you did not increase taxes this year, but we have the pension crisis coming up and other things down the line. So what do you foresee happening in 2016?
Well, first of all, let me say that when I came into office, we had a $3 billion budget and a $487 million, almost $500 million gap to close. We had no budget and no plan for a budget. And in the space of 3 months, we put a budget together and then passed it. And I said, we're never going to be in this position again. So by executive order, I said we're going to present a budget to the people by the end of June for the upcoming year, and give people a chance to respond and comment, a preliminary budget in June, and then submit our budget proposal in October. And that's what we've done. We've had a very open, transparent budgeting process ever since that first budget cycle, so starting in 2011. And every year since, we've done that. We've presented a preliminary budget in June and then a final budget in October, and had a public budget hearing from the President's office, as well as hearings that the Board of Commissioners, our legislative body, had all over the county. So we have worked hard to be open and honest about our budgeting process and transparent about how the money gets spent. This is going to be a difficult year, 2016, partly because there's a spike in our debt payments, and partly because hopefully we'll have pension legislation that will require additional support from the employer, that is the county. But we've been very creative in the last 4 years in dealing with our budget issues, looking to be more efficient and to operate as well as we possibly can with the resources that we have. So we're going to start there, looking for efficiencies. And then we're going to try to figure out what the needs are, given our emphasis on efficiencies and creative ways to look at the provision of services. But this is going to be a challenging year, not just for the county, but for the city and the state as well, all of whom are facing fiscal challenges and in particular challenges around pension reform.
We have about another 5 minutes left in our program this evening. We'd like to spend the remainder of our time maybe revisiting some of the topics that have already come up. And let's go back where we started with the public health system. And Maybe you could talk a little bit about how you balance being responsive and responsible to both taxpayers and patients in the county health system.
Well, first of all, I'd like to thank Dr. Jay Shannon, who's the new Chief Executive Officer of our healthcare system, has taken office in the last year, and Hill Hammock, who's Chairman of the governing board, independent governing board of our health and hospital system, and all of the good people who serve with him. I'm grateful to be able to work with that team. Our health and hospital system, as I said earlier, historically had been in the business of providing care for the uninsured and underinsured. But as a result of the Affordable Care Act and the expansion of Medicaid to include low-income people, for the first time in its history, our health and hospital system has more insured patients than uninsured ones. So the Affordable Care Act and the expansion of Medicaid has been a fiscal boon to our Cook County health and hospital system. In addition, we've worked very hard with the hospital leadership to reduce the taxpayer subsidy to our healthcare system. When in 2010, just before I came into office, the subsidy was more than $400 million a year. The subsidy is now about $164 million in the budget that we just passed last fall. So there's been a reduction by half of the taxpayer subsidy of our health and hospital system due to efficiencies and a careful look at operations. So I'm hopeful that we can be innovative in the ways that we deal with our fiscal challenges, but it's going to be a difficult year.
Let's go back and talk a little bit about public safety and the criminal justice system at the county level. I think when you stepped into office, the jail population was around 10,000, and
right.
Because of your recent reforms, you've shrunk that population down to a little over 8,000. What's your goal for moving forward, and do you think you'll find support in Springfield for your vision?
Well, we have tried to put an emphasis on reducing the number of people accused now, not convicted, accused of nonviolent crimes in our jail. And we're trying to provide alternatives to detention, people being out on their own recognizance, that is, their own commitment to return to trial, people on electronic monitoring, people on intensive pretrial services, so that people can stay in their jobs and in their homes and with their families as they wait the adjudication of their cases. So the jail population for 10 years had been averaging about 10,000, plus or minus. It's now down to 8,300. It's down 10% for the last 8 months, year over year. And we hope to bring the jail population by the end of the year down to 7,500. So a 25% reduction in the jail population. And we think we can do that. And again, we're only talking about people accused of nonviolent crimes, not people accused of violent crimes.
I think we have another caller on the line. Caller, are you there?
Yes, I'm here.
Your question for President Preckwinkle.
Yes, Tony, this is Laverne.
Hi, how are you?
It's good to talk to you today.
Hi, how are you?
I'm fine. What I want to know is, are we expecting, I say we because I'm working hard too with Will Burns, are we expecting a huge turnout in the election, for the election in February?
Thank you very much for calling, Laverne. I appreciate it. It's always hard to predict what voter turnout is going to be, but people in Chicago take their aldermanic elections very, very seriously, and I think we'll definitely see voter turnout higher than a year ago in the March primary in 2014, where I think we had historically low turnouts of about 13% in the city of Chicago, and I'm not sure if it was much higher in the county as a whole. But I'm hopeful that we'll have a good turnout. You know, if you're going to be a citizen in a democracy, you have to vote. That's your first obligation, necessary but not sufficient. It's also very helpful if you work for candidates you believe in and support them financially. That's what makes our democracy strong. So I'm involved in a number of aldermanic races, supporting not only my own alderman Will Burns, but Pat Dowell in the 3rd Ward, and Leslie Hairston in the 5th, and Rod Sawyer in the 6th. So I've got my hands full between now and the last Tuesday in February. But I'm grateful to those folks for the good work that they've done, and I really enjoyed my 19 years as alderman. So I've got a kind of history there to fall back on.
We're about out of time. We'd like to thank Cook County Board President Toni Preckwinkle for joining us tonight on Political Forum. Thank you, President Preckwinkle.
Thank you. Thank you for inviting me, and I hope to come back soon.
In order for our democracy to thrive, we need an informed and engaged citizenry. So we'd like to thank you for tuning in. We'd like to thank you for calling in, and we'd like to invite you to join us next week, Wednesday, at 7 o'clock for the next edition of Political Forum. Good night.
Thank you.